Chairman, Mr. Whitty, good to see you. Thank you for making yourself available to me in my office and the back end of these attacks. Healthcare entities and devices are increasingly connected to the internet and other healthcare facility networks to provide features that manage administrative functions, increase efficiency, or improve the ability of healthcare providers to treat patients. We, of course, have to have confidence these systems and tools can be used safely and securely in order to reduce risks and vulnerabilities for patients and providers. There remain some unanswered questions and lessons to be learned from this attack. You've acknowledged that. Mr. Whitty, one of the workarounds for payers and providers, which we discussed, was to move to a different clearinghouse, including Change Healthcare's competitors. How long could a transition take for a provider to be fully up and running with a new vendor?
Senator, thank you for the question. That can be, I think, within just a few days. I can come back to you on really a more educated assessment of that, but I would say a few days to a week or so.
Okay, and well, that's okay. That gives me a rough estimate. Is Change Healthcare helping with these transitions?
Yes, in fact, we recommended and diverted clients to as many alternative competitors as possible, and we will continue to encourage clients to have a backup system in place, so to have at least two alternate channels in case there were future attacks in the system.
And I know this has already been covered a bit, but to confirm, there's been reporting of exclusivity clauses between Change Healthcare and its clients. Will any exclusivity clauses be enforced? And what should providers be aware of if they transition to a new provider?
Senator, you're quite right that the legacy Change Healthcare contracts indeed did have exclusivity clauses. We've waived those and we would not intend to enforce them because we want to make sure people have backup capabilities in place. Okay.
All right. Thank you. Tulip Tree Family Healthcare is a community health center in the southern part of my state. It's unable to switch clearinghouses. They indicate it's a time-sensitive process for their billing department, which has 2 people, and connecting to the new system could put their cyber liability insurance at risk since it hasn't been guaranteed secure. They've turned to a 100% paper submission of claims by mail, incurring all kinds of overtime expensive and significant postage costs for a small healthcare center that tries to provide the most they can for their patients. Tulip Tree learned about the attack from the national news. Do you have a notification process in place, sir?
That's a very good question, and that's one of the areas where I think we need to figure out how to communicate, not just for companies but for government. We saw the same thing in COVID. It was very difficult to communicate with providers across the system. In this particular attack, our customer files were compromised in the attack, so they were encrypted, which made it very difficult for us to reach out directly to those clients. I would say in this particular situation that you described, we'd love to reach out to your office, understand who that clinic is, and if we can help them in a technical transition, yes, or if they need financial support during the bridge to the new supply, we'd be happy to help.
And you did mention that those mechanisms you've created to provide that financial bridge. I am encouraged by that. How are you more broadly disseminating information to providers, particularly, these small safety net health centers like Tulip Tree?
Again, thank you for the question. So we've used everything from our UHC insurance provider bulletin, which goes to about 1 million physicians across the country. We've used social media. We've sent something like 700,000 emails to a variety of different provider addresses. We've tried to use every channel. We've worked with all of the key medical associations to encourage associations to get the word out to pharmacy, to providers and others. And of course, we've been running regular national telephone calls for technology leaders across all of the organizations and encouraging them to spread the word in their regions. So, for example, large hospitals encouraging them to spread the word. But I do think communication to providers, in whether it's a cyber situation or a pandemic situation, I think that is an area which repeatedly comes up as an area for opportunity.
Thank you for answering my questions, Mr. Whitty. I guess the only other thing I would ask is you know, you will have all manner of lessons learned, including that there may be limitations under existing law to being able to respond to these sorts of attacks and serve your clients optimally. To the extent those lessons are learned, I ask that you communicate that information to my office and to this committee so that we might consider changing the law.
Thank you.
All right, thank you.